Okay. I'm going to talk about traditional Chinese medicine. And the term traditional Chinese medicine is very interesting. Actually, what is taught now in China and throughout the world that's called traditional Chinese medicine is actually only the amalgamation of medicine since the 1950s in China. So in the 50s, with Mao in power, there was a lot of discussion about the need to integrate these two medical systems. The Chinese have been using traditional Chinese medicine for 2,500 years. Ayurvedic principles, which are somewhat similar, go back thousands of years before that. So they knew it worked. There's massive amounts of evidence that it worked. And they knew that biomedicine or Western medicine was also something they needed to use. And so the discussion was, how do we integrate those? And the question was, do we take traditional, or what actually Chinese medicine is the base, and then bring Western medicine to it? And so that what that would look like in Chinese medicine, it's all about the person. It's all about signs and symptoms and not about diseases. So 10 people could come in with a diagnosis of multiple sclerosis, and they might all get treated differently. Or I might get 10 people with different diseases that would all get treated the same, dependent on their personal needs and their personal pathologies. So that went round and round, back and forth. And finally, and so in the Western medical system, of course, it's disease-based. Someone has a particular condition that is treated in a particular way. So the decision was made to use Western medicine actually as the base and use the disease names of these illnesses, and then bring Chinese medical treatments to that. So it's kind of interesting. So traditional Chinese medicine is actually not the traditional medicine. It's actually an integrative form of medicine. For example, my doctorate was taught about 50% by doctors, mostly from Stanford, and 50% by doctors that were flown over here from China. And then I flew to China to study with doctors over there. So it was very much an integrated type of protocol. So, and to me, that's what we're seeing here is the importance of integration.